My name is Christine Hext, and I've been putting patients first for 17 years.
Hi, my name is Candy Hitchcock, and I've been putting patients first for 38 years.
My name is Rob Lefebvre, and I've been putting patients first for 17 years.
Hi, my name is Cecile Rumiel, and I've been putting patients first for 32 years.
Our CCAC is dedicated to putting our patients and families first.
We've always been dedicated to our patients' care and always will be.
Our employees at the Erie St. Clair CCAC are some of the most committed health professionals that I've ever worked alongside. They've been leaders in home and community care for decades and will remain at the forefront of innovative and high-quality care for years to come.
Just ask our patients. They've put us tops in the province among CCACs for patient satisfaction. With our continued rollout of new services like telehome care and the use of innovative new devices like Gecko, we're aiming to increase patient satisfaction even further.
This technology was developed in the UK, and we were one of the 2 CCACs who tested it as part of the worldwide pilot project, and we trialed it with our patients that were the worst of the worst in terms of their wounds. We didn't pick the patients that had wounds that would heal easily, and some of these wounds had been present for months to years.
It's nice to talk about quality of care and services. It's quite another thing to take it a step further and achieve international recognition. In 2015, we were reaccredited by CARF International for another 3 years based on the quality of care that we deliver. We were the first CCAC to receive this distinction back in 2012.
The Erie St. Clair CCAC was established in 2007. We have always looked for ways to strengthen care. That dedication led us to become the first CCAC to be associated with the Institute for Patient and Family-Centered Care.
We have successfully recruited 30 patient advisors who are helping us incorporate the patient and family perspective into our decision-making.
Patient advisors will look at the different aspects of what CCAC does and try and make them better and more related to what the patient's needs are.
We are working more diligently than ever in helping patients with their questions or concerns. Between myself and our patient relations specialist, we have engaged over 350 patients in the last year to ensure that any issues that they have are being heard and addressed.
We're also engaging our community and all of our health sector partners to ensure that we're on the right track with our strategic plan. We held 3 strategic planning sessions in Windsor, Chatham, and Sarnia, where we presented on our progress in year 1. We were applauded for our focus on patient and family-centered care, involving patients and family members in everything that we do. We were also noted for our telehome care program, which has helped 220 patients to self-manage their chronic disease. We know that we have many organizations willing to work with us, better leveraging the system integration in the name of improved care for our patients.
Our CCAC has worked hard over the last year to find internal efficiencies, including restructuring management and focusing on high-needs patients. We have achieved an in-year budget surplus for 2015-16. Our financial statement is available on our annual report website.
CCACs as a sector have been in the news quite a bit over the last year. Most of this attention was tied to the Bringing Care Home report, led by Dr. Gail Donner, the Auditor General of Ontario's report on CCACs, and the Ministry of Health and Long-Term Care's Patients First discussion paper. In Erie St. Clair, we were able to leverage this additional focus on the community sector by highlighting our services, innovation, and community outreach through over 50 positive news stories.
CCAC representatives provided public education about our programs and services at 66 community events and speaking engagements across Erie St. Clair in 2015-16. We honored 67 paid and unpaid caregivers at our 3rd annual Heroes in the Home caregiver recognition events in Windsor, Chatham, and Sarnia.
Under the leadership of the Ministry of Health and Long-Term Care, the Erie St. Clair CCAC will continue to deliver on the provincial vision for a strong home and community care health system. It is our privilege to be doing so with our health sector partners and community agencies for the benefit of our patients and caregivers. The future of care in our community is in good hands, as all of our healthcare professionals, support staff, and managers are prepared to meet the needs of our community as the system continues to evolve.
Well, on behalf of the board and myself, I want to take this opportunity to thank the entire CCAC team for their hard work, for their dedication, their resilience over the past year. Our patients are tops, they're number one on all of our priorities. We know they're getting the right care in the right place at the right time.
Home and community care has a bright future in all of our communities across Windsor, Essex, Chatham-Kent, and Sarnia-Lambton.